7 Italian anti-tank mines dug in the road. Blew me out. I was on fire.
I remember hearing an explosion and then blacking out. And luckily, while I was blacked out, was the time where I was engulfed in flames.
Blew the engine block off one way and sent me out the other. The guy in the truck behind me, he said above the smoke cloud, he saw this black mass flying. I just disappeared, basically.
Roadside bomb went off, pretty much took off my whole lower mandible. Teeth, everything was gone.
The boiler was damaged and it ended up exploding. As we were evacuating the space, we were getting burned by steam that was well over 1,200 degrees.
Didn't really feel any pain, and then slowly but surely it started kicking in, and then I really kind of knew that I was in trouble.
Honestly, I was thinking, I hope they don't call my mom.
It's a whole other nightmare than of just surviving. It's the second stage of, living and being able to adapt. You don't know what your future holds, what you're gonna be able to do with your kids, how people are gonna look at you.
It was almost like that wasn't me staring at myself in the mirror.
How can my kids and my wife, or especially my wife, how can she be intimate with the monster? How can my kids want to be seen with the monster?
I would get a lot of stares and a lot of looks, and I started, isolating myself, and that's when my family kind of stepped in and said, you need to do something.
Operation MEND is a collaboration between UCLA and the military medical community to provide subspecialty services, share the expertise that we have at UCLA in various clinical disciplines with wounded warriors from Iraq and Afghanistan to try to optimize their care and get them back on their feet.
Operation MEND to us is really an extension of our purpose. It's taking care of really our brothers and sisters and making sure that they get the absolute best care that the private sector has to offer, coupled with the most respect for what they get from military medicine and our Veterans Administration.
We can give a complete set of services, which is a really holistic package of taking care of their family, their psychosocial well-being, and their physical well-being. And I'm happy to say that Operation MEND is free to every service member and their family who qualifies and is referred appropriately.
Initially, we were doing predominantly secondary burn reconstruction, a lot of catastrophic facial burns.
My face can't really hide it. It's the center of attention. It's what everybody looks at. It's what everybody sees. It's kind of who you are. My left eye, the lower eyelid was drooped down about halfway. At one point, I didn't have any nostrils.
Joey thought about it and ultimately had a couple of relatively straightforward operations to establish a normal contour of his eyes, repositioned his lip, allowed him so that he could oppose his lips.
My eyes are back up where you can't see the interior. My nose is a little more shaped like a nose. Now that I'm kind of put back together, you can definitely tell my expressions, and my eyes are back up. When I smile, it actually looks like a smile. Humpty Dumpty put back together again, so to say.
Operation MEND began with facial reconstructions. Then we saw the ones that have had facial injuries have had head injuries too, orthopedic injuries, psychological injuries. So Operation MEND expanded to be able to meet those needs of the wounds of war.
My hands, my fingers were kind of bent up, and my palm was kind of attached over, so I couldn't grab anything. I couldn't pick anything up. I couldn't open anything. Trying to be able to do those little things, because really I'm alive now. It's just the quality of life, I want a better quality of life. I want to be able to do certain things. He opened up web spacing, was able to pull my thumb back, fused a couple joints so I could, use those a little bit better. It's an art.
So as I've watched Jay, he's become ambitious in seeing that there is a future for him.
Where I'm now, where I'm, playing golf again. coach t-ball with my daughter and play catch and my son, and being able to do stuff that I used to do. And I mean, that just helps you move forward.
I'm in AW2, which stands for Army Wounded Warrior. My AW2 advocate, he sent me an email about this and didn't even consider UCLA because I didn't even think it was an option.
So Joey Barr came to me. His vehicle hit an IED. He sustained some multiple leg injuries. He wasn't able to do the activities that he wanted to do, such as running, biking, exercising. He was a fit young man prior to this.
The way she looked at the MRI, she looked at it for like 2 minutes and she had a game plan on how to fix it.
He's had 3 knee surgeries since he's been here at UCLA and 1 shoulder surgery.
I can say my left it's better than I ever expected it would be. I'm striving for perfect. I think the sky's the limit.
We got called out to look for a sniper. I had to stand up and move people out of the way. I was shot in the back of the head behind the right ear. The bullet entered the right side of my jaw, kind of came in here and shattered the cheekbone, the jawbone.
Jason, from a reconstructive standpoint, was probably the most complex patient that we have taken into the program.
I sat down and I said, I want to be able to smile again. So Operation Men did a nerve vein transplant for me.
We set about reanimating the paralyzed side of his face. So this was a 12-hour operation with 3 of the microsurgeons working together.
And I'd say about a year later, I was in the bathroom at home and I was just trying to smile and this and that. And then all of a sudden my right side started moving again.
When he came into the room and smiled, that was the most exciting day that we've had in a long time.
They make me feel young again. They give me that, hey, nothing's wrong with you. You can do what you want to do.
Traumatic brain injuries or TBIs, whether it be mild, severe, I had no clue really what it was, and I'm lucky enough to be a part of OpMend and for them to have paved some new avenues in advanced diagnostics in determining TBI in patients.
When one of these young men or women come to our care, really from the moment we make contact with them, we're treating them like they are our own family.
So as soon as we get a referral, we take all of the stress off the case manager and the patient to coordinate all of their care. So we don't want them to ever feel alone when they're here.
And it's all coordinated, they'll tell you where to go, when you need to be there, what time, and help you get there, rather than throwing everything on you as you're already overwhelmed with your recovery.
The patients and their families become very close with us. Over time, it becomes a great friendship.
We want to make sure that the family, as well as the patient, are resilient.
Operation Mend has a family care manager on staff that meets with the patients every time they're here and their families. With the stress that they're going through, it's really important to have someone to talk to and to build these resiliency skills and communication skills for going home.
They want to know about your family and your friends and what's going on in your life. If you're struggling with something emotionally, they can help you.
It really helped us together as a couple, and I can't thank them enough. It brought us so much closer together.
We've always been a close family, but being injured and being apart from my kids for that long was very emotional.
They have been not only good to my husband, but if I'm hurting emotionally, they've been there for me. And we always joke about, no, wait a minute, who's the injured one here?
Hey, we want to talk to your wife, or we want to bring the kids in and see how they're doing, and it makes the kids feel important.
Jill patches us together, I guess. She just makes sense of everything.
The people in Los Angeles want to support our veterans, and there aren't a lot of ways to do it. And the Operation Mend Buddy Family programs give them a hands-on way to get involved and really make a difference in the life of a wounded warrior and his or her family.
My buddy family, they pick you up, and it's like they just kind of put their arms around you and say, hey, whatever you need.
They take the dynamics of your family, match it up with the dynamics of a buddy family so that everybody has somebody to talk to. This buddy family comes in and supports your family while you're being taken care of by the hospital. It's a very family-oriented place.
When we first met our buddy families, it's kind of like a shocker a bit that people from totally different worlds can really understand us and get to know us at a personal level.
It's meant a lot to us because you're not just abandoned in a foreign town you're not used to. They've taken us out to countless places to keep everybody happy.
The family support component is so strong. You need family around you to heal.
It means so much to me to work with these patients. They are incredible people.
These are true heroes. So the passion that you see in us is really a reflection of the incredible inspiration that these young men and women spill out every day.
I'm very lucky and very happy and pleased with everything that Operation Men has done for me, just because I've experienced so much more in life that I probably wouldn't have had I not had the procedures.
They gave me back that sense of confidence, security, independence.
I have 2 boys. I just want to be there for them. I really do. And my wife, be a family person now.
A lot of nonprofits don't really change lives. This really changes their quality of life, their new normal. You know, their new normal is a lot better than what it was. And from burns to hands to brain injuries to eyes to whatever, they're changing lives.
You can have all the best surgeons in the world to heal this. But if you can't heal this, what good does it do? So when you have it all working together, you have Operation Mend.